Hello? Okay, good afternoon, everybody. Happy Sabbath. I'd like to share a little bit about how our church can play a role in the obesity epidemic from the perspective of suffering. Where is God when people suffer? I know you all know this story. It's the story of who? The Good Samaritan. So here was a guy who was walking down a path that people knew was dangerous, right? He knew it was dangerous, but he probably was in a hurry. He wanted to get home soon or to get to the market first, so he decided to ignore what people knew about safety and go down that path. And what happened? He was attacked, right? So when Jesus told the story, it seems to be that it was something that had just happened. It was in the news. So Jesus kept abreast of current events. And he's telling the story, and we are told that some of the people who were in the story were actually in the crowd listening. So he gets attacked, and 3 people pass by. And we know that the first 2 didn't help. The third one did help. One of the hardest questions we have to answer in this day and age is, where is God when I suffer? Especially in our country, people believe there is a God. They know that there is a supreme being. They don't know if he cares. And that's a very difficult question for us as Christians to answer, because sometimes it might seem easier to believe that there is no God when innocent people suffer than to believe that there is a God who is all-powerful, all-knowing, present everywhere, and allows people to suffer. So when we as Christians are asked, where was God when I went through this problem or that problem, or innocent children are killed, or people who have lived lives that are obedient to every health principle we know and still fall ill with diseases that we're not supposed to suffer, the hardest question to answer is, where is God? What did Jesus do when he was here? This is what he said he was going to do. He said the Spirit of God was upon him and had anointed him not only to preach to the poor, but to heal the brokenhearted, to proclaim liberty to captives, recovery of sight to the blind, to set at liberty those who are oppressed, to proclaim the acceptable year of the Lord. What do you notice in these things that Jesus mentioned he was going to do? Is it only about spiritual health? What else is there? Physical health? What else? I hear a lot of murmuring. Somebody brave to shout it out. Thank you. Mental health. So when Jesus spoke about his own mission, it was a whole mission. It wasn't just about one aspect of a person's life. It was about every aspect of people's lives. What did he actually do? He fed the hungry, raised the widow's son, healed the lame, the blind, cured those with mental illness, talked to those who no one wanted to talk to, was compassionate with sinners, wept with those who were sad. And yet he knew that there would come a time when people would ask, where is God when I suffer? And this isn't just a spiritual question. It was actually also a physical question. And that is why we see in Matthew 25, he spoke at least 4 parables telling his disciples, there will come a time when I won't be here, the absent landlord. There will be a time when I won't be here, the faithful and evil servants, the parable of the 10 virgins, the parable of the talents, the one of the sheep and the goats. In each of those parables, there's a season when the landlord, the owner, the king, the master is not present. So when people ask, where is God when I suffer, they're actually missing his presence there. What are we as Christians supposed to do? Where was God when the Jew that was going down the hill in Jericho was attacked? Where do you think he was? Well, if you were the one walking down that hill and were attacked, what would you do? Someone said do this so they protect your head. What else would you do? Scream, but no one's going to hear you. Pray, yes. So isn't it something kind of funny that in this place that was away from everywhere, 3 people passed through in what could have been about half an hour time because the thieves left him almost dead. By the time the Samaritan walked by, he was able to rescue him. So it couldn't have been more than half hour, 1 hour since he was beat up till the 3 people passed by. How could it be that in a forgotten, lonely place, 3 people walked by? What do you think that was? I think that was an answer to the man's prayer, right? So where was God when he suffered? He was in the priest, in the Levite, and in the Samaritan. He should have been in the priest, in the Levite, but he actually was in the Samaritan. So God was present in the person that helped him and relieved his suffering. And the role of the church in the suffering of people is to be God's presence. So when people say, "Where is God when I suffer?" what is the church supposed to do? I'm here. He said, "The kingdom of heaven is at hand. Heal the sick, cleanse the lepers, raise the dead, cast out demons. Freely you have received, freely give." So the reason we do it is why? It's because we think it's kind of cool? Is it because we're being paid to do it? It's because of a mandate. Our master said that we need to. That is why we do health ministries, because he said we need to. So it's about revealing Christ. And this quotation I know you've heard before. How shall we reveal Christ? I know of no better way than to take hold of the medical missionary work in connection with the ministry. These are the images we usually think of when we think of people suffering. So we see teenagers smoking. The upper right hand, left hand for you is the tsunami, where there were so many dead that they just took bulldozers and did mass graves because there was no way of identifying everybody in time. The bottom 2 are Nicaragua, after one of the years when weather conditions did not allow for workers to be able to continue living in the fields where they worked, so they were kicked out to the streets. So when you think of people suffering, aren't these the images we usually think about? But guess what? People are suffering. Those are images that are around us every day of people that are suffering. Except sometimes when we see them, we think of them like we think of the Jew that was going down that lonely Jericho road. He had no business walking down there. He knew it was dangerous. And sometimes when we see people that suffer from obesity, what is our thought? They know better, right? You should know better. It's everywhere. It's on TV. It's in the news. It's everywhere. All you got to do is eat less and walk more. How hard is that? Right? And yet, there are so many different factors that are associated with obesity in every age, in every ethnic group, in every country, that as a church we need to be aware of those to be able to help those who are suffering. I'm going to show you some maps, and I'm going to run through them because it's important to see the progression. So I'll explain a little bit before. This is CDC data, Centers for Disease Control here in the United States. And they've been measuring obesity trends for years. This is from 1990 to 2010. Whenever you see a state that is white, it means there's no data. If it's light blue, there's low obesity rates. As it goes through stronger blues, the rates are getting higher. Then it goes through yellows, oranges, and when you see a red, it means that that state is in deep trouble, okay? So what we're going to see is the progression of obesity from 1990 to 2010 according to CDC data. Are you ready? You ready? All right, okay, let's go. Are you seeing how they're turning bluer and bluer? Okay, now we're in the 90s. No more light blues. 97, we start with yellows. 2000, we start with oranges. More than 25% of the population is obese in the orange states. 06, 07, 8, 9, and 10. What do you see? Is there any blue left? Not a single light blue state. Can you imagine? And this took how long? Less than a generation, right? Less than one lifetime. But we know better, right? We have studies that show that if you're a vegetarian, especially if you're a vegan, your risk of being obese is a lot lower than if you're not. This is data from Adventist Health Study in women and men. And the green columns are those who are vegan. The red ones are not vegetarian, and look at the difference in pounds. Isn't that something? We know that, right? So why is it that it's so hard for us to communicate this message in a way that makes a difference in people's lives? Because you know there's been Seventh-day Adventist churches in all those states that turned from bright blue to orange and red, right? So I'd like to spend a few minutes talking about practical ways. A little bit more, because you've been talking about that all along. Practical ways that the church can help those who are suffering with obesity. And I'm going to use literature mostly from those who do not belong to our faith, people from the outside, who are talking about faith and churches in general. Faith-based organizations are promising because many Americans have high levels of religiosity. They go to church. They use religion as a coping strategy and indicate religion or prayer contributes to their physical health. So we're going to talk a little bit about these: prayer, peers, people, programs, safe place, Sabbath, and research. First, prayer, and you see that one, I have it blank. There's not a lot of research that can explain how prayer changes things. Do we need research to know that? Does prayer only change things? It changes us. It changes people. So as we think about how our church can contribute to relieving the suffering, one of the first things we need to do as a church is pray. And ask God to show us the ways in which we can do it in our own community. And we need to start at home, because there's people in our church who are suffering from this. This isn't only an outside problem, right? It's an everybody's problem. So the first one is prayer. Then peers. It's been found that people engage in healthy lifestyles when there's prayer, relationships with others, pastoral support, feeling included and accepted, and feeling like one could trust the healthcare provider. On the other hand, discomfort, unfamiliar people, not feeling included in groups, being alone, and living alone are barriers to healthy lifestyles. So what does that mean about the church environment? How should it be? What kind of church environment should it be? Loving, what else? Caring, yes. Friendly, embracing, sensitive to other people, judgmental, pointing fingers, critical for their own good. No way. Young people indicate that meeting new people in church-related activities encourages them to be active, and adults find that they can be role models. Families are changing. When I was reading this research, I was surprised. It says that families are becoming more democratic, and I had to laugh because it's true. When I was growing up, I did not get a choice in what was set on the table. I had to eat it, and I couldn't get up until it was done. Right? Now I have 3 boys, 11, 9, and 6 months, and even the 6-month-old decides he does not like green peas and does not eat them. Times have changed. The how we eat as a family is as important as what we eat, and studies have found that in families that eat together and make it a point of eating together, of having healthy meals together, there is less of a chance of those children to grow up obese than in families where everybody kind of goes around doing whatever. Okay? People. So the people in church are important. There's something called reference. Reference are people that you look to for advice, who pressure you or inspire you to change your behavior. Who do you think the reference are in our churches? Who could it be? And you can see it there, so you can tell me. The pastor, health professionals, nurses, health ministries directors, all of these people are reference. And one of the people who was studied said, I need to have information, the real truth, because you hear so many things. Okay, you can, you should, you shouldn't use certain things. Oh, now it's okay to do that when before. Have you heard research like that? One day it's okay to do one thing, the other day it's not okay to do the same thing, and then the same day 2 different people are talking about the same thing in opposite ways. That's why it's very important that any information that comes from the pulpit in our church is true. It's based on evidence because people trust what comes from here. So you need to be sure that what is spoken from the pulpit is true. Programs. Basic characteristics of programs. They need to be for the entire family. Why? Who has time? A lot of people don't go to church activities because there's no time and they need to spend time with their families. What about activities where they can spend time with their families and improve their health at the same time, right? Age appropriate, so something for everybody, culturally appropriate. Not everybody feels comfortable doing Zumba, salsa, and aerobics shorts, right? No. So some people are more comfortable walking. Some people are more comfortable in competition, so culturally appropriate. Consistent, that's a problem we have. We get all fired up. Okay, now we're going to do it January 1, and by February 2, okay, so consistent. And a word about potlucks. Make sure that you foster grace. Not everybody who brings food is where you are in your spiritual journey. It's better that they come and learn on the way than they feel rejected because their plate is too rich in this or has too much of that. Okay. So both men and women in the studies mentioned that physical activity programs they would go to in churches. Why? Because it's a safe place. They don't feel as safe running around in the streets, especially nowadays. But if the church had an exercise program for their kids, they would take them there. So what's a practical way of us being every church a community center like Dr. Landless talked about this morning, about not keeping our churches open only on Sabbath morning and Wednesday prayer meeting? Is during the week, use the building to have community activities. When you have those open, not only church members will come, the community will come because everybody feels unsafe. And a lot of people would like to practice physical activity in a healthy environment. The Sabbath, it matters that you keep it. It's shown that it increases your health. It matters how you keep it. Those who engage in secular activities on Sabbath, like watching TV and shopping, have less health benefits than those who don't. It matters why you keep it. If you keep it because you think that you're forced to or because other people are watching you, the health benefits are not the same. Research. How many of you here participated in Adventist health studies? Let me see your hands. Okay. Please keep doing that. Because no one else is more interested in this than faith-based organizations. If you do not continue to participate, we can't know to provide a scientific base for us to share this information with the world. Why the church? Because it's a place where all of these things can happen. Because we are motivated by our love for God and his love for us, and by his mandate to heal the suffering. Interventions providing a variety of choices with a spiritual base that are available to the entire family in a convenient and safe place such as the church is important. Every little red dot you see on that map, you know what it is? It's a Seventh-day Adventist church. So if every one of those little red dots was a place where people could come to learn about how to have healthier lifestyles in a safe environment that will lead them to connect with Jesus, this is what would happen. We would go from this to this. God bless you.
It's an epidemic, isn't it? But the beautiful thing is that the Seventh-day Adventist Church has taken a stand on this. And we have been able to partner with several groups. We have in our ministry here in the North American Division partnered with our schools, with our hospitals, and many other ministries of the Seventh-day Adventist Church. We have our pastors involved, our ministerial team involved. We have children's ministries, we have women's ministries, we have community services, we have family ministries, our chaplains. All of the ministries of the Seventh-day Adventist Church here in North America have been involved in promoting this lifestyle that brings hope and wholeness. And with that, we have the Adventist InStep for Life initiative that was launched about 2 years ago. And in partnership with the First Lady's Let's Move initiative, we have been then reaching out to our communities, as you saw earlier, getting them moving, getting them to understand what is a better way of eating healthy so that the children can learn at home and in school better ways that they can have habits for life. And we praise God for the opportunities he has given us. We have had, just last year, over 10,000 people that have participated across the division that signed up on our website, that are reporting their miles of physical activity, that are planting community gardens. We have over 100 community gardens just in this division that churches and schools have started, and they are reaching out the community in that way. We have had our students and our PE teachers and our schools really taking an active role in bringing health up to the center once again. So we praise God for the work that many volunteers, many leaders have taken to really lead out their church, their school, their hospital, and their communities in this effort of increasing and improving the health of our communities around the country. We also would like to share with you that we have reached our goal last year. In 2011, we started with 1 million mile goals of physical activity. We reached nearly 2 million. Amen? Amen. And that's congratulations to you. Last year, we increased our goal. We doubled it. And we said, we're going to try to reach 2 million mile goal, 2 million miles of aerobic activity. And thanks to the effort and to the work that you're going to be looking and learning today, some of what has been done across the division, we overpassed that goal. We reached 2,245 miles of people who actually, 2,245 miles that people actually reported online. So we were thrilled, and today we're going to be having the opportunity to then award everyone, our institutions, our schools, our hospitals, and our churches who have really put a lot of effort in this. And so at this time, you're going to have a little taste of some of what we have developed to inform and to engage our communities through the video that is next.
One step at a time, one community at a time. The Seventh-day Adventist Church is on the move, We're answering Mrs. Obama's call to reverse the trend toward childhood obesity. So we're challenging our members to exercise, change their eating habits, and motivate their communities. And it's worked. We walked over 2 million miles in 2011, 2/3 of the national goal. We've set aside Sunday, September 23rd, 2012 as Let's Move Day for our entire church, including schools and hospitals, to participate in any physical activity. More than 10,000 people altogether participated in last year's community event. We've also received support from U.S. Surgeon General Dr. Regina Benjamin and representatives from Mrs. Obama's Let's Move program office and the U.S. Department of Health and Human Services. Getting healthy starts with our kids. Our goal is for 60% of Adventist students achieve the Presidential Active Lifestyle Award this year. We're encouraging and teaching regular exercise in our Adventist schools and recognizing those fit kids with awards. Well-balanced meals are key to any exercise routine. That's why we're pledging to launch 100 summer feeding locations for community children. In order for good habits to take root, we're creating 100 new vegetable gardens and farmers markets throughout North America in 2012. The Seventh-day Adventist Church makes it easy to get involved. Our website, AdventistInStepForLife.org, has received thousands of hits. Its practical, user-friendly interface has a Let's Move toolkit that any church, school, or hospital can use. Users can find training materials and suggestions to get started. There's even an InStep for Life app for those really on the move. We're making lifestyle changes that last. The Adventist Church is getting in step for life for the future of our children and our communities.
Good evening. We want to welcome you once again to this Health Summit. This afternoon, we'll be having a brief discussion with some representatives, some leaders of our church here in the North American Division and in the Atlantic Union Territory on the subject of health, obesity, and how the church can be involved in the community. But before we get to that, I'd like to ask you $1 million question. Let me let you in a little secret. In New York, our mayor, Mayor Michael Bloomberg, works for $1 a year. He's not just a millionaire, he's a multi-millionaire. So if Mayor Bloomberg were to welcome you to New York and would say to you, I will give you some of my wealth, I will give you $100 million. And he says to you, choose. What would you prefer, wealth or health? What would your choice be? You're saying health now because, but if offer me $100 million, I'll take both. What we want to hear from Mayor Bloomberg, he has sent a message for us today, and I'd like to introduce to you James Richmond. He's the community liaison in the Office of Communication for the Greater New York Conference. I am Pastor Rohan Wellington, Communication Director for the Greater New York Conference, and Richmond is going to read at this time a letter from Mayor Bloomberg.
Thank you, Pastor Wellington. I choose life, full life. From the City of New York, Office of the Mayor, New York, New York. Dear friends, it is a great pleasure to welcome everyone to this week's Health Summit, hosted by the Adventist Health Ministries North American Division. Thanks to our innovative public health policies and the efforts of our health and human services agencies, we are encouraging even more New Yorkers to lead healthier, more active lives. By supporting programs to stop the rising tide of obesity epidemic, expanding the use of preventative care, and more, our administration is working to offer all our residents the tools they need to stay healthy. With this week's summit, Adventist Health Ministries is playing an important role by providing health professionals and community leaders with the training, information, and resources that will enable them to more effectively address the health challenges facing our city and nation. We applaud all those attending for their efforts to make a difference in the lives of those they are called to serve, and look forward to all they will accomplish in the years to come. On behalf of the City of New York, I offer my best wishes for a productive event and continued success. Sincerely, Michael R. Bloomberg, Mayor of the City of New York. Thank you very much. Have a pleasant evening.
All right, we continue with our president for the Atlantic Union, Elder Don King, and the president of the North American Division, Elder Dan Jackson. Question for you, gentlemen. Tell me, what role does the church play in health in the community? How can the church impact the community with health?
Well, I'll let my president go first.
Seventh-day Adventists have always been preoccupied with the health of the community from the very onset of the church. The medical missionary, medical ministry of the church actually spans the globe through hospitals, clinics, health projects carried out by local congregations. The church is extremely interested in the health and well-being of the people who live in the communities where they are located.
All right, you know, New Yorkers are very expressive. They like to express themselves. And you've heard of what Mayor Bloomberg is trying to make New York a healthy state, try to make New Yorkers healthy. Nobody wants to talk about obesity. But obesity is a problem. Nobody wants to be told I'm fat or I'm large. You know, everybody wants to be told I'm okay. That's none of your business. So tell me, is Mayor Bloomberg's message his message or a message that the church should be sharing?
I think Mayor Bloomberg is right on the money. He is basing his initiative on science. He's basing it on the data and the research that's been done. And I'm very proud of a mayor that really looks out for his citizens in this way and is encouraging nutritional principles rather than just going along with the flow and encouraging people to eat foods that lend themselves even in greater ways to obesity and so forth. So I certainly applaud Mayor Bloomberg's work and initiative, and I'm very excited about what he's doing. For example, there is an initiative known as the Green Card Initiative, where
That has anything to do with immigration?
well, I don't know, but I'm only sharing with you what I read about his Green Card Initiative, which is an initiative to give loans and grants to mobile food vendors and what do you call them? These stores, the convenience stores, throughout the entire New York City. If they will stock their shelves with fruits and vegetables, I think this is tremendously an unprecedented event, and he is leading the way, not just in New York State, but the entire United States and probably the entire world in this. New York City will thank him in the years to come.
Elder Jackson, you spoke about prosperity today. 3 John chapter 3, 1 and verse 2 talks about, "Beloved, I wish above all things that you prosper and be in good health." I could deal with some prospering and some good health. Tell us, from your message today and to those who are attending here, what prosperity should we embrace and how can we share that with the world?
Well, I think, as long as we think in a materialistic way, we would assume that prosperity has to do with dollars and cents and houses and cars and so on, and those things are okay. But they are not the genuine, long-lasting things that bring prosperity. I think people come to understand how valuable their health is when they lose it.
Yes.
It's a significant problem, and I think, in New York, when they hear of some of Mayor Bloomberg's initiatives, a lot of New Yorkers just want to say, forget about it, right? But the reality is, it is a vital thing for us to prosper in health, in mind, body, and spirit. I think those are the meaningful things. And if we, by some chance, are able to accumulate those things that give us creature comforts, a house and a car and so on, those are great things as well. but they can never be superseded by the prosperity of the health of an individual.
Gentlemen, we are out of time, but quickly. You have health professionals, health leaders here. What message would you leave for them to encourage them to share this message with the world?
I just want to say that the Atlantic Union Conference is very, very supportive of this summit and the work that all of our health leaders and health educators are doing in this union and also around the entire country. The tremendous outreach that they're making. And I just want to say, too, that I'm very proud of my church. My church is on the cutting edge of health leadership in this country. I just wish that we could make ourselves more well-known around the world for that and utilize the information, the research, and the data that have already been done on Seventh-day Adventists to show that we truly can live healthy lives and we can live happy lives.
Great. Elder Jackson?
I think I'm just going to say something very quickly, and it's a challenge. I think that we must take it up a notch, and that is that we must become even more intensely involved in the work of health ministry and taking care of needs as we see them, as they exist in our communities. But my commendation to all of you for taking the time and making the effort to be here. God bless you, and may you prosper and be in good health.
As we go, you have something you want to say quick?
No, go ahead.
As you go, we're out of time. Please, don't spend your time trying to get wealth at the expense of your health. God bless you.
Thank you.
Well, now I would like to introduce to you a person who has been instrumental in our partnership. She is actually part of the First Lady Let's Move team from the White House in the Office of Faith-Based and Community Partnerships. She's also working for the Department of Health and Human Services, Heidi Christensen. And some of you might remember Heidi. Well, welcome to her. Heidi has been instrumental in the partnerships that we've developed with the White House over the last 2 years, and we're thrilled to have her always here in our Health Summit. She attended last time in Orlando. Do you remember?
Oh, my word. I wouldn't. I'm so happy to be here. Happy Sabbath, everyone, and thank you. It's such an honor to be with you. Hi, Heather. I just saw you up there. So shall I say a few words?
So yes, we would like to see what you have to tell us, and you're going to introduce to us some other special guests.
I will.
So thank you, Heidi.
Thank you, Katya. Well, hello. It is an honor to be here, and what a terrific year you all have had. Yay. Thank you for this invitation to be here to celebrate with you and the extraordinary work you do around the country. But I also want to thank Katya Reinert, of course, and Pastor and President Dan Jackson and Vice President Deborah Brill. They are just extraordinary partners on this journey of bringing health and wellness to the nation's families and communities. But I will be introducing in this way and also thanking two members of Health and Human Services, outstanding regional leadership. Dr. Jaime Torres is our regional director, and Dr. Michelle Davis, regional health administrator. Many of you have might have met Michelle. Well, you guys, why don't you come on up while we're doing this? Yeah. So Dr. Jaime Torres, regional director, and Dr. Michelle Davis, who some of you, if you'd gone to the Flushing race, would have seen her. Yes, she was there. So they're with Region 2, which is New York, New Jersey, Puerto Rico, and U.S. Virgin Islands. The Department of Health and Human Services has 10 regional offices around the country as a resource to you and the communities you serve, and both of our fine folks here will tell you more about that. So, but first, I would like to say a profound thanks to each of you. Our work at the Center for Faith-Based and Neighborhood Partnerships at the Department of Health and Human Services, we facilitate the First Lady's Let's Move Faith and Communities initiative. And by that, we kind of support community health leaders like you with resources and research and sort of news about exemplary practices around the country that may be adapted in ways that make sense in your community. But I must say, and this will be a repeat of the heart of my comments last year because it's true, you are the gift givers in this relationship. the Adventist Health Ministry leaders of the North American Division, only because I've not met your international counterparts yet, but I'm sure they're they rock the health profession, the health promotion world as well. But you are the model for community-based health leaders around the country and for their national directors. See, underneath the extraordinary tools and resources you have developed, you offer others something foundationally important. Your ministries demonstrate the innate link between faith and health, and the programs you implement connect this link in action and service. With your help, important health messages are translated in ways that have meaning for the communities you serve. And with your help, unhealthy behaviors are being changed as folks find hope in shared values and faithful perspectives. You teach that health is embedded in the day-to-day life of your faithful practice. It's this deep weaving of tradition, theology, and practice that underpins the prophetic wisdom that has had the Adventist communities leading others through the wilderness of this important and timely work. And I really heard that witness in Pastor Dan's sermon this afternoon. It's essential. So earlier this year, I'll just take one more minute, a faith leader in a very large Detroit community said to us, well, why do I need a health ministry in my congregation? Like, why don't they just go to the gym? So in response, Let's Move Faith and Communities co-hosted with Sue Heitmuller, who many of you may know from the Adventist healthcare system in Maryland. And we hosted this oversubscribed national webinar called Community as a Source of Health and Wellness, to proclaim that communities are not just a vessel for health ministry, but rather an intentional place for healing and an environment uniquely poised to link healthful practice to faithful living. What you as health leaders are able to do is create the ways that these connections, these paths to healing, get lived out in community. What our partnership center and the regional offices can support is access to evidence-based scientific tools and resources and initiatives and programs that can be adapted as you see best as it works in your community. For instance, I want to promote just an opportunity that we'll be running for April and May, and Katya will be getting this information out to you all. We'll be hosting several 2-hour webinars on the National Institutes of Health's We Can curricula, which you will also be able to download the curricula for free at no cost to you or your ministry team off the internet, and we'll be running these trainings for the next 2 months. So I hope you look out for that schedule and join us for that. Thank you for all that you do to heal the mind, body, hearts, and spirits of those you serve. Each one of you is a gift to the aspiration for a healthy and whole nation. Amen. Thank you, and congratulations. So I'm going to call now, actually, Dr. Michelle David.
You have to go first.
Do you go? Oh.
According to
No, we had you going last because you're the big wig. We have you going. So, Dr. Michelle Davis, take it away. Okay.
Well, good afternoon, everybody. Good afternoon. I'd like to thank the North American Division of the Health Ministries Department, including Dan Jackson, your president, Jose Rojas, your director of the volunteer ministry, Tricia Pinnacock, Dr. Tricia Pinnacock, who just spoke, Delbert Baker, Ned Neely, Katya Reinhardt, as well as Heidi Christensen, who just spoke, who, as you know, is our Director of Community Engagement for the HHS Center for Faith-Based and Community Partnerships, because she has done wonderful efforts all across the country to enlist faith-based communities to work on health and wellness issues. I'm honored to be here today to celebrate, to celebrate the good work that you have done in the Adventist community, including in the schools, in your congregations, in your hospitals, and all the achievements you've done to meet the Step for Life, Let's Move goals during 2012 and 2013. Health ministries such as yours are a leading HHS partner, and you demonstrate the CDC definition of community engagement by working collaboratively with and through groups of people affiliated by geography, special interests, or similar situations such as faith to address issues affecting the well-being of these individuals. Complex health and social problems, such as obesity and physical inactivity, are ill-suited to be addressed by outside experts alone. That's why Seventh-day Adventist is, once again, a leading partner of HHS on all of these initiatives. Through your InStep for Life program, you conduct activities to improve your community's health. And as Heidi stated, I witnessed your efforts firsthand when I participated in the 5K run walk held in Queens last year. I enjoyed that Let's Move event so much last September that I began riding my bike all around New York City so that I could improve my health and wellness. You support the overall efforts of Let's Move initiative that was begun by First Lady Michelle Obama, as well as Let's Move Faith and Communities, which is designed to help faith-based and neighborhood organizations transform their neighborhoods, their communities, and engage those communities and promote healthy choices. Social issues affecting the obesity epidemic, such as food insecurity, which is the lack of adequate and nutritious food, many families begin to depend on the low-cost food from convenience stores, as well as fast food businesses for their daily nutrition. The social determinants of health, which you've probably heard about, which include poverty, poor education, health literacy, or food deserts, not having places in your neighborhood where you can buy nutritious food, are occurring all around this country. And as Dr. Pennicock has already shared with us, it is critical that we utilize fitness to improve the health of our communities. Every one of us has an important role to play to improve our health and wellness. And the efforts of your church exemplifies that message. You also support the Surgeon General, Dr. Regina Benjamin, who participated last year and published her vision for a healthy and fit nation in 2010. She called on all Americans to join in a national grassroots effort to reverse the trend of obesity, and that includes showing people how to choose nutritious food, add more physical activity to their lives, manage stress that so often derails the best efforts in developing our healthy eating habits. She envisioned that men, women, and children who are mentally and physically fit in their lives, they will be able to live their lives to the fullest. The real goal is not just a number on a scale, but optimal health for all Americans at every stage of life. To achieve this goal, we must all work together to share our resources, educate our citizens, and partner with business and government leaders to find creative solutions in our neighborhoods, towns, and cities from coast to coast. Together, we can become a nation committed to becoming healthy and fit. I would like to congratulate and thank you for your efforts that you have undertaken, especially your partnership with the U.S. Department of Health and Human Services, and your support of all of our national wellness initiatives, in particular, Let's Move. So congratulations. And thank you for allowing me to share a few minutes with you.
Thank you. Good afternoon, everyone. Or like they say, we're in a bilingual city. Buenas tardes. Okay. So, like Katia mentioned, our region is very vast: New York, New Jersey, Puerto Rico, and the Virgin Islands. And the temperature right now here is 37 degrees, but in Puerto Rico it's 87 degrees, by the way. So next meeting, maybe we can make it there. So I am delighted to be here, and I bring you greetings from the whole Department of Health and Human Services, but also from our Secretary, Kathleen Sebelius. My colleague, Dr. Michelle David, and I really appreciate the opportunity to be part of this discussion of an issue that is a big concern to this administration: childhood obesity, and the efforts that we are undertaking as a department to address this problem. But also, we want to thank you for your work, and I've been seeing a little bit of it, because the faith community plays a crucial role in promoting good health among the communities that you serve. As you know, the President and Mrs. Obama, and also the Secretary Sebelius, have committed the efforts and resources of the federal government to raise public awareness of the need of a comprehensive commitment to combat childhood obesity, but also to win that battle. We have learned from our healthcare providers that a few simple lifestyle changes can make real improvement in our health and the health of our loved ones. So sometimes small steps can bring big rewards. So we must continue to increase our efforts to educate, encourage our friends, families, neighbors, so they can take responsibility for their own health. And we commend the Health Ministry Department of the North American Division of the Seventh-day Adventists, and especially Kathia Reinhardt, for the task you have been charged with, that every church be a center of health, healing, and wholeness. As you know, the job is not going to be easy, but the rewards are going to be big. Both is going to change life, body, and souls. And as it was said earlier by Dr. Tricia Pinnacock, over the past 3 decades, childhood obesity has more than doubled in our children and tripled in adolescents. In 2010, more than 1/3 of children and adolescents in our nation were overweight or obese. And today, pediatricians are diagnosing an increasing number of children with type 2 diabetes. And research shows that 1/3 of all children born in the last decade will develop type 2 diabetes in their lifetime. 1/3. But also, the number of adolescents receiving dialysis because of diabetes induced by obesity has increased. Can you imagine that? Sometimes a few pictures are more powerful than words. So you remember the slides that Tricia showed a few minutes ago, from blue to red? That tells it all. Let's be clear. That tsunami that we saw on the screen is really damaging our fellow citizens, our families, parishioners, our nation. As it has been said before, we are in danger that for the first time in the history of our nation, the next generation may have a shorter lifespan than our generation because of diabetes and its complication. In addition, the economic costs of obesity are enormous. The annual cost is now estimated at $120 billion, direct and indirect costs, second only to tobacco use. But the good news is that there's still time to reverse this dangerous trend in our lives. And let me see if I can manage this. Here we go. So when the president took office, it was clear that inaction on health care was not an option. That is why he fought very hard for health care reform, and on March 20 of 2010, he signed into law the Affordable Care Act, which is the new law that is changing how health care is being provided right now, but also how it's going to change the landscape of health care for years to come. This landmark law, with this landmark law, we're beginning to replace a current sick care system, healthcare, with a genuine healthcare system where we're focused on wellness and education. And we're beginning to reward healthcare providers for the quality of care they provide and not just the quantity of care. The Affordable Care Act would enable our nation to address the rapidly increasing childhood obesity rates with some of the projects, because we're trying to prevent the doubling of that crisis that is expected to double by 2030, but there's still chance. The law contains a number of provisions that would address, I'll just remind you, this is the slide. Remember that, from blue to orange and to red. So the Affordable Care Act has some provisions to address childhood obesity in the context of health care and public health. For example, because the law right now, all plans must cover prevention and wellness benefit without copayments and deductibles. And that will be true for children and adults. The law also provides millions in funding for childhood obesity demonstration projects. It also improved nutrition labeling in fast food restaurants, which will list the number of calories in our venues. It also covers for maternal and child health care to promote breastfeeding and early childhood nutrition, something that has been proven time and again to reduce obesity in our nation. Community transformation grants, which give grants to community-based efforts to prevent chronic diseases, are also been affecting our nation. These grants create and sustain communities that support prevention and wellness where people live, where they learn, where they worship. So these are some of the initiatives that are beginning to change the look. That map that we saw, we're beginning to change the look of that map in our country. All of us in HHS are excited to this challenge, and we're working very hard, but also we're looking forward to working with you, partners in the faith-based community, because the years ahead are challenging, but again, the rewards can be great. And before I conclude, I want to show you one photograph of someone that maybe you will recognize. This was me at age 15, and I weighed 250 pounds. So as you can see, this fight is not only personal, it's professional, but it shows that sí se puede. All of us, we can do it together. Thank you so much for your attention.
Thank you, Dr. Torres. It's a pleasure to have this partnership with the Health and Human Services Department. Aren't you blessed that we have that here? And we are just thrilled to have you.
Thank you very much.
God bless you.
Congratulations.
Thank you. So now is a very special time that we're going to have. I'm going to invite our President, Dan Jackson, to come up. And it's the time that everybody's been waiting for. The time when we're going to be able to recognize those institutions that have done a terrific job in mobilizing either their school, their church, their hospital, partnering the community to really share this message of hope and wholeness, that there is a better way to live in Christ. So we're going to start first with our unions and conferences. And I'd like to read their names. They're going to come and get their award. And we have lined up here our guests. I'm going to ask you to come a little bit over that way, a little bit more. Yes, because we will take a picture with each one of the awardees this afternoon. So first, I would like to call up Southwestern Union Conference with Pat Humphrey. Very good. Pat has done a wonderful job there, and they got awards for miles in the union. We also are going to call David Long with Southern Union Conference. Very good. Among the other unions, we have the Columbia Union Conference with Leah Scott. Very good. Leah gets 2 awards because she gets it both for the Columbia Union as well as the Allegheny East Conference, who has had the most miles within the Columbia Union. So, Leah, this is the second year she gets 2 awards for that area. Now we have in the Mid-America Union, we're going to recognize the Kansas-Nebraska Conference with Hubert Cisneros. Kansas-Nebraska Conference with Hubert Cisneros. And he is going to be recognized at this time. You know, Hubert has done a wonderful job with Pathfinders, but the Kansas-Nebraska also have engaged their schools. And so we're thrilled that they are getting this award, the leadership of Hubert. Mm-hmm. So we're now going to go back to the Atlantic Union. And we have Carlisle Simmons, Elder Simmons as the Health Ministries Director. And this is the union where we are at right now in New York. And you saw all the excitement that happened here last year. And so we're thrilled that they're getting this award as well. We are going to go now for the conferences. Georgia Cumberland Conference with E.W. Dempsey. Last year they got several awards as well. And the southern, in that region of the Southern Union, and the EW has led the group since this was initiated several years ago, and we're thrilled to have his leadership in the Georgia Cumberland Conference. Now, another conference that has done tremendous work, particularly when it comes to the miles and the community gardens, is Northern California Conference under the leadership of Gordon Body. So Gordon Body is the next leader that gets this wonderful award, and he has done a tremendous job with mobilizing dozens of churches to have community gardens there. Now we go up to the area of the North Pacific Union, where John Lohr is represented the Washington Conference, who got the most miles and got the most participation in that union, the North Pacific Union. And John is doing a terrific job. He's going to continue to engage their leaders there. Last year, his office took some time, and they all went out on X Move Day and did their event. The office did that at the North Pacific Union, so we're thrilled. Next, we have the Arkansas Louisiana Conference, which Pat Humphrey, once again, comes back. And Pat gets it for both the Texaco Conference as well as the Arkansas Louisiana Conference. And Pat last year did a wonderful job partnering with several institutions. And we're shortly going to see a video of the work that she's done there. And so we're thrilled. She's actually getting 3 awards this year for her union, the Southwestern Union area. Now we come again here in this Atlantic Union. The conference in the Atlantic Union that did the most miles is Pastor Warchlick under Southern New England Conference. This is the second year consecutively that they've recorded the most miles in the Atlantic Union. I know a lot happened here in New York, but still the Southern New England Conference continues to lead the crowd in Atlantic Union. Then we now go up to the north of our division in Canada. Canada is also participating, and we have 2 conferences that are getting awards with Maria McLean representing them. These are the British Columbia Conference and also the Manitoba Saskatchewan Conference. 2 of our conferences in Canada who are doing a tremendous work. And I was there with them last year for camp meetings, and people were excited there. Lots of miles being recorded in Canada. So thank you, Maria, for your leadership there. Now I would like to recognize the Adventist Health Systems. You know, one of the groups that we are thrilled to participate and collaborate with is the Adventist Health Systems. And Lionel Mountain is here representing Adventist Health Systems. Last year, they got an award. Out of all of our health systems, they are recording the most miles. And they also are the ones who partnered with Pat in Texas this past year. And now before we continue with the awards, you're going to see what they did in their area. So hold on that video, and let's see what Pat Humphrey, Lionel Mountain, and the Adventist Health Systems, along with our schools, did in Texas.
Today is Let's Move Day. It's September 23rd. It's a national event to combat childhood obesity, and we're encouraging everybody in the city of Burleson to come out here to Hughley Hospital and to walk and run and exercise. And we want to get everybody involved because we want to be fit. We want to have a fit community here in the city of Burleson, Texas.
Go, 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 go! Oh, they're going to run it. Awesome. I'm going there. You want this?
Well, we're with HEB, and we brought HE Buddy out here to support our community with Let's Move Day, and we're excited to encourage families to stay fit and get active and be healthy. And Buddy's out here with some bottled water and jump ropes for kids.
Move those arms. We're moving, moving. Looking good, looking good.
I was able to go around 3 times to do the 5K, and I feel invigorated. I don't know how I feel later on, but thank God I'm alive now.
Well, I got here at around 8-ish, and I did all the activities here. And they were all based on health and everything, and I feel I am way more knowledgeable than I was.
The way that we want you to do now is we just want you to just come straight down and back up. Straight down and back up.
Down, up, down, that's 10, up, down, down.
Swing those arms, come on in strong. Swing your arms, come on in strong.
We're out here from Joshua Adventist Multigrade School to help volunteer and participate with the Let's Move Day at Hughley Hospital. We're out here promoting our health of our students, and we heard about this through our church and decided it was a good thing to get involved with and sent our kids out here and hoping to get enough to be able to count it as a day of school.
We have invited everybody from the community, our family and friends. Our goal today is to walk 1 million miles, and we're going to do it. So thank you all for coming. Let's move.
We got out here early and we thought we'd get a head start and be the first ones to the finish line, and we were. And we feel great. We walked our mile and now we're ready to help others.
And today I decided to do 12 miles, and this is part of my marathon training for the Dallas Marathon in December.
Well, in this room, this is the waiting lobby at Hughley, and we've got a health expo going on.
And you go to different stations, and we're taking the blood pressure, we're teaching about hydrotherapy, weight loss. We have a 1 mile run.
Yeah, we have them being able to take their blood pressure and learn different ways to be healthier and just increase the health of our community.
Yes, at this booth we have a piece of software that helps us calculate people's health age based on their health activities and their age. That helps them understand where they are in life.
Creation Health is a whole person approach to health. We realize that when it comes to wellness, you can be disease-free but not well if one of these universal principles of health is missing from your life. So we're just here to support the Let's Move event and also to begin working with Hughley Hospital and Southwestern Union Conference on health initiatives throughout this multi-state area that'll be launching in the months to come. So we're just glad to be here with Let's Move, and it's been a fabulous event. Thank you.
You're gonna breathe in first, and then when you're ready to blow out, like you're blowing out birthday candles, you put your mouth all the way on it and blow hard.
And seal it.
There we
Good
go.
job.
Awesome.
You did great.
Okay, that was good. So that was 2:30.
Just continuing to follow the eight laws of health.
Up, down, down.
Ready?
Ready? Begin. Up, down, down. Up, down, down. Up, down, down. Up, down, down.
We're giving people healthy tips to maintain healthy weight and good diet, promoting walking, promoting what else?
Community
Good
nursing.
health.
How to eat, good eating habits, just doing a little counseling with everyone that's coming up to them.
We're trying to get everybody heart healthy as well.
Yeah.
Okay, and what are you studying in school?
Nursing.
Thank you to Hughley for supporting us and hosting our event today for Let's Move Day.
That's
right.
Thank you, Hughley.
The end. Bye, Facebook.
Bye.
There you go. So do you see how many nurses are involved? Nursing students, nurses leaders. But isn't that a wonderful opportunity to partner? I love this because you see there the schools partnering, the universities like Southwestern University. You saw our hospitals, you saw our churches, and the community. And so it's a wonderful, this is what this initiative is all about. Now we have more awardees. We have been, we're now going to talk about a group that has been very important with us in Adventist Health Ministries, the Complete Health Improvement Project. They're also getting an award, and we have here Stefan Herzog, who is representing the CHIP Association. You know, chippers have been walking for a long, didn't start walking with InStep for Life, but now they are recording that officially as part of their program. And so we're thrilled to have CHIP involved and encouraging the former and the current chippers to continue walking and recording their miles. We also now going to recognize schools. And among all of the universities that have done a great job at this, they have a wonderful program there, is the Southern Adventist University. And Lily Tryon, who is a professor there, is going to represent Southern. And they've done the most miles. They've been actually, a lot of their teachers have their own pedometers. They're recording this daily. They have a center of fitness and wellness there, and they're leading out in that area of wellness. So we recognize them and are thrilled for what they are doing. Now, we also have our academies involved, and from all the academies, the one that had the most miles is, again, in Leah Scott's territory, the DuPont Park SDA Junior Academy. So DuPont Park SDA Junior Academy got thousands of miles, got everybody involved, and they really deserve this. They did a wonderful job on Let's Move Day and throughout the year, because this is not just about one day. It's about recording your aerobic miles throughout the year. Now we're going to go down to the local church where the action is happening. And we have with us 4 churches that have excelled and show within the unions the most participation rates and miles. And I'm pleased to award the Spencerville SDN Church. Dr. Lindless is actually the health ministries director there, along with another doctor and their team. So they're getting an award. As a matter of fact, Dr. Lindless himself gets more than 15,000 steps a day, and religiously every day. So he is recording those steps on our website as well and leading out in this area. So thank you, Dr. Lindless. And thank you, Spencerville. Now, on the West Coast, we have Paradise SDA Church, and Gordon Bonney is accepting the award because it's in his conference. They got the most miles and participation rates in that area of the Pacific Union. So we're thrilled that that local church is doing a wonderful job. They have wonderful community gardens. We have awarded them a grant and with community services, and they're doing a great job there when it comes to the Let's Move in Adventist InStep for Life initiative. And again, down in the Southern Union area, we have Collegedale SDA Church, represented here in the Georgia Cumberland Conference by EW. Both Southern Western University, which you saw, they got that, Southern University. And now Collegedale SDA Church, which is right there, is also getting the award. So they're active in EW's conference. The last and not least, the church that got the most miles is Emmanuel Brinklow SDA Church. And who do you see again? Leah Scott. So Emmanuel Brinklow is one of the churches in the Allegheny East Conference that they have more than 20 community gardens. That one church, they had so many community gardens that they're sponsoring, and they're really participating in this initiative. So we're thrilled. Thank you so much to our leaders for helping us award this wonderful group of institutions. And thanks to all of you who have been supporting this initiative. Now, it doesn't end here. This initiative continues on, and we're just going to continue growing and encouraging our communities. And we already have the date for next year's Let's Move Day. And that would be, of course, this year's, we have Let's Move Day on September 22nd. So save the date, prepare your calendar so you can engage your communities to participate. But we want our kids to be involved. And so with that, we're going to leave here a call to you from our kids with a video that is following for you to participate with us.
What's going on today? It's Let's Move Day. Walk, jog, and run. Let's Move Day. Let's Move Day. Get up, everyone. Goodbye, habits. Changes have begun. Let's move.
To live long, healthy lives.
Let's move.
To set a good example for others.
Obesity is out of control.
Let's move! Why? Because God expects us to. Let's move day. Walk, jog, and run. Let's move day. Let's move day. Get up, everyone. Let's move day. Let's move!
Right before us of death and life, yearning for our hearts and minds, good and evil waiting for our choice. I've decided I will live my voice. I choose for life. Healing light, Son of God, Christ the Lord, Creator, life. I choose for life, and I'll tell the world that life is mine. Earth and heaven witness every man, everything shows for whom we stand. Words of blessing we must then decide. Who will win? Who will be our guide? Life I choose for life. Healing light, Son of God, Christ the Lord, Creator, life. I choose for life, and I'll tell the world that life is kind. Living water, He's the morning star. He's the strength for the broken heart. Bread that satisfies the hungry soul. He's the love that the world must know. Life I choose for life. Healing light, Son of God, Christ the Lord, Creator, life. I choose for life, and I'll tell the world that life is right. Life I choose for life. Healing light, Son of God, Christ the Lord, Creator, life. I choose for life, and I'll tell the world that life is right. And I'll tell the world that life is
Well, you know, the wonderful thing that happens when organizations collaborate together is that they become effective. and the Health Ministries Department of the North American Division has made a very deliberate and intentional decision to collaborate with every available department. And what I want to do is to encourage you who are watching, you who are here, find someone in your congregation, another ministry that you can connect with in order to produce healthy, happy, whole people. And so I'm going to do something a little unusual, or it's not unusual, but it's special. We're going to invite the people who represent the various aspects of the work of the North American Division to come and stand here representing the various departments. Now, the principal of the Whispering Pines School is here with us today, and she's going to represent the Department of Education. Her name is Shirley Ann Thomas Lawrenson. I'm going to ask Shirley Ann to come out and just stand over here. And right following her, I'm going to invite Katja Reinhardt to come and stand at her side representing health. Then Linnell Mountain is here representing the health system of the Seventh-day Adventist Church in North America. Then youth, the youth department represented by Manny Cruz. Manny, please come. Well, Manny, you got to clap. The others didn't. So I don't know what you did, but there were 4 people clapping for you. That was good. Representing women's ministries, we're going to invite Donna Jackson, a lady I'm fairly well acquainted with, to come and join us. The ministerial department of the North American Division, Esther Knott. Family life, we're going to ask Deborah Brill to come. And Advent Source, we're going to ask Brad Forbes to come and join us. And from Adventist Community Services, Sung Kwan. Now look at that. Now I want you to know that he has 2 children here who initiated that clap. And I think that's the group. I want to congratulate all of these people. You know, it takes creativity and humility to work together. To say, okay, I'll drop my barrier down a little bit so that we can find common ground and common cause. And I just really want to commend each of these departments. It is a buzzword in the North American Division these days, and that is, let's get together and collaborate in all that we do. So before these folks leave the platform, and before we all leave, we're going to ask the children to come back. Aren't they coming back?
Yeah, Clayton is coming back, and he should be over here. There he is.
All right. He's almost here. He's here. And are we going to sing together?
Yes, we will.
The children aren't going to do that for us, though.
They're there. They're coming.
They're coming. All right, children, however many of them.
We've heard it. We have enjoyed it. Now it's time for us to sing it. Okay, once again, I choose for life.
All right, please.
Let's stand together.
Stand with us.
Before us are death and blood, battling for our hearts and minds. satisfy the hungry soul. He's the love that the world must know. Life I choose for life. Healing light, Son of God, Christ the Lord Creator. Life I choose for life. And I'll tell the world that life is Christ.
Amen.
Would you bow your head with me as we pray? Our God and our Heavenly Father, Creator of the heavens and the earth, we want to honor you today because of what you have put in the hearts of men and the minds of men and women. Heavenly Father, we think of all that has been done and all that has been accomplished, and we look to you as the source. We praise you for your love, your grace, your mercy, and for your creativity. Bless everyone who is here. We thank you for the willing participation of so many, and we give you praise and honor in the name of Jesus. Amen.